What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dasani. Today, I have somebody that I've been following for a while online. She fascinates me with the work that she is doing and just the level of expertise. So Dr. Valerie Cacho she's actually an integrative sleep medicine specialist, and she focuses and Dr. Val, just correct me if I'm wrong, but she focuses on diagnosing and treating not just medical sleep disorders, but sleep concerns in women as it relates to insomnia, self-compassion training, which I think a lot of us could do well with keeping in mind. And I am not envious at all. She gets to practice in California and Hawaii and help people in both of those states. So welcome to the show. It is such a pleasure to have you.
Thank you, Meghna. Very happy to be here.
I am going to jump right in because I have all these questions swimming around in my head.
Sure, let's go.
So always first is like, why sleep? How did you get into it? And what made you decide to focus on the topics that you do focus?
Yeah, that's a great question. So I grew up in a medical home. My father is a cardiologist. My mom's a nurse. And, I have uncles who are dentists. And so I feel like I was always a little bit pulled towards a career in healthcare, but I never really wanted to work in the hospital. When I was younger, I'd have to, sort of hang out with my dad sometimes when my mom was busy in the hospital. I just didn't like the environment. I thought it was a little bit smelly. This was like a little bit way back then. And then also he was an interventional cardiologist. So his work always pulled him in the middle of the night to the hospital. And, sort of early on, I knew I didn't want that kind of lifestyle. And one of his good friends, the pulmonologist and a sleep doctor. And I heard him give a talk, maybe high school or college. And it was just really fascinating. And I just learned more about sleep and learned how it's so vital for overall health. Back then, growing up in the 80s, being a kid, yeah, definitely you would sleep, but people around you wouldn't really prioritize their sleep. Sleep wasn't in vogue as it is now. And as I learned more about sleep through medical school, through residency, and even fellowship, it just really made sense in terms of the life I wanted to live. There's really no sleep emergencies, and it's a really holistic type of career. And I'm very interested in treating the whole person. So my background is in internal medicine, sleep medicine fellowship, and integrative medicine fellowship. I just combine all of the three to really help someone along their healing journey when it really comes down to their sleep health.
I think you nailed it. Growing up, we never thought that sleep was important. I remember growing up and my uncles and my parents going, "Oh, we'll sleep when we're dead."
Yeah.
And look at it turned over on its head now. We're like, you gotta sleep, which I try to make sure my girls get enough sleep. So I'm so glad that we have evolved to that.
Yes, agreed.
As a woman, and I'm perimenopausal, so these questions always come up. Well, first off, does menopause and premenopause, perimenopause affect our sleep, our metabolism, and how and why and what can we do? I have so many questions. So
yes. No, my favorite question.
That.
Yeah. And let's see. I think a simple way to break it down is mind, body, and soul, really taking that holistic approach. And part of it certainly are hormonal changes. As we get older, we do have changes in our sex hormones. Perimenopause, to define it, is fluctuations in your estrogen and progesterone levels. Typically, it starts around age 47, but can happen even in the late 30s. And then menopause, when you go a year without having your period, is 51. So what do those fluctuations in your hormones do for your sleep? Well, keep you from falling asleep, keep you from staying asleep. From an emotional standpoint, can lead to more irritability, anxiety, depression, and those, mental health conditions can have a bidirectional relationship with sleep. From more of a physical standpoint, which I'm sure you see probably in your practice as well, is, as we get older and we lose some of the estrogen and progesterone, our airway gets more floppy. So rates of obstructive sleep apnea double to triple from a premenopausal woman to a postmenopausal woman. And that definitely can disrupt the quality of sleep that you have. And then bring on top of that, not to scare anybody, but just with the reality of situations, sometimes I call it gifts of Father Time or Mother Nature. You get hot flashes. When we lose the estrogen, when there's abrupt changes, hot flashes can really disrupt the quality of sleep that you have. Some women are drenched where they actually have to get out of bed, change their clothes, change pajamas, change their sheets because they are so uncomfortable. But I think there is hope, right? So there are treatment options, there are medications. There's integrative treatments like different supplements, clinical hypnotherapy, mind-body therapies, and even something as simple as, I would say, cognitive behavioral therapy for insomnia can improve the symptoms of menopause. Because the way I think of hot flashes and disrupting sleep, sometimes it's the anticipation that they're going to happen. Early on in my career, I worked as a nocturnist in the hospital, and I was the only doc in that whole hospital. And so I'd be covering the ICU, the floors, the ER, and I never knew when the pager was going to go off. So it could be 2 o'clock in the morning and be really quiet, and I could sleep, but I wasn't able to sleep because I was anticipating that beep, beep, beep from the pager. So that happens to women as well. We're probably, okay, maybe we're not sure if we're going to have a hot flash, but we have a heightened state of awareness in of ourselves. And that can also disrupt the quality of sleep. And then going beyond that, as we get older, guess what? We could have our own medical issues aside from menopause. Maybe we're developing diabetes or high blood pressure, and those medications or those, conditions can disrupt our sleep. Maybe we're concerned about our weight because as we get older too, we have lower levels of growth hormone, and that makes it harder to lose weight. Maybe we have really stressful lives and, excess cortisol, and that can lead to excess belly fat. That's also hard to lose. And so then we start to do like intermittent fasting, and that in and of itself, if we're almost starving ourselves, can cause middle of the night awakening. So it's like a whole host of factors. And then onto the social psycho factors, right? You're getting older. Maybe your parents are getting older. A lot of women are caretakers for their elderly parents. When they're in the hospital, typically it's the daughter who's sitting at the bedside. The daughter's going to the office visits with their parents, and also maybe they have kids to take care of. So it's really just a busy time. And there's a lot of factors that can play a role. And so really, taking the time and space to talk to a woman as, okay, so what's going on with your sleep? Is it something physical? Could it be obstructive sleep apnea? Or is your mind racing? Are you having ruminating thought? Typically, it's not necessarily a magnesium deficiency. A lot of the sort of things I see online, it's like, what do I need to take to be able to go to sleep? And, sometimes you do have deficiencies like vitamin D, that can be associated with insomnia, but it's really taking a look at the whole person.
So for our listeners that are not fortunate enough to be able to work with somebody like you, where should we start? What is a good place for us? Who should be the first provider we should be touching base with?
Well, I would honestly say yourself, do a self check-in. And I think for a lot of the women that I talk to, it's almost the norm that we're tired. And when you talk to your friends, you talk to your colleagues, your coworkers, like everyone's tired. And just because everyone's tired and it feels normal or it's common, it doesn't mean that there isn't something wrong or your body's not telling you something. So definitely, talk to your healthcare provider, if it's your nurse practitioner, your physician. But I think at the end of the day, it's, take a look at your own symptoms and, could you benefit from getting better sleep? Or, maybe it's a diet change, or maybe it's an exercise thing, or it's a lifestyle thing. Maybe you're taking too much on and you need a little bit more help around the house or at work. So definitely check in, see what's wrong. If you're exhausted and all your friends are exhausted and you're around the same age, it could feel commonplace, but it's not normal. And then talk to your doctor about it, because there is a workup for it, in terms of taking a look at making sure you don't have diabetes or thyroid issues, or checking some of your hormone levels, which can be helpful. And then one thing to note is that there's not a lot of sleep doctors out there, and primary care doctors. I was a primary doctor myself in medical school. We learned about sleep maybe 1-2 hours. So if they aren't able to answer all your questions about sleep, then keep digging. Sometimes you do really have to advocate for yourself. Ask to get a sleep study. Some of the data shows up to 93% of women are undiagnosed with obstructive sleep apnea, because oftentimes what happens is you go and you're saying you're tired, and they say, oh, you're a busy mom, or you have a full-time job. You just have a lot on your plate, and you get sent to a therapist because maybe they think you have depression, or have your thyroid checked, and it could be an underlying breathing condition. So just advocate for yourself. Ask for the sleep study. If you do a home sleep study and it's negative, ask for the in-lab study. The reason for that is, I like to say, women are smarter. We have our brains are a little bit more sensitive. So we have a type of sleep apnea where if our airway partially collapses, our brain can wake us up before it completely collapses. So typically most home sleep apnea kits don't monitor your EEG or your brain waves. So it can miss a small select of patients. So keep going, advocate for yourself, and ask to talk to a sleep doctor.
Yeah, I think that is such sound advice. Check in with yourself first, and don't take no for an answer if you don't feel the way you actually should be feeling. What are some of the holistic ways that you would recommend to help a menopausal, perimenopausal woman actually sleep better, get to better sleep if they are suffering from insomnia? What are your recommendations there?
Yeah. So I would say step one is always prioritize sleep, because if you think about what sleep is doing for us, if you're going to go on a long car ride, right, you want to make sure there's enough fuel in your tank. You want to make sure that your phone's charged, you have enough battery. And sometimes we're just operating on low levels, low power mode, a little bit on empty. So prioritize sleep, because I'm a big believer in sleep and bias, but I think sleep makes everything better, because when you're tired, it's just harder to make those healthier choices, right? It's so much easier to go through the drive-through than plan, cook a healthy meal. So prioritize sleep. Number two is figure out how much sleep you need. And what do I mean by that? It is recommended for adults to get between 7 to 9. Some people are closer to 9. I think I heard from some research 8 hours and 15 minutes is probably ideal. A third of the US population, adults, aren't getting enough sleep. Less than 6 isn't really helpful because it's associated with more cardiovascular disease and even metabolic syndrome and difficulties with weight. But find out how much sleep you need for you. What's your sweet spot? Where do you feel good? And then match that with your circadian rhythm. What do I mean by your circadian rhythm? That's your internal clock. Are you more of a night owl, or are you more of a morning person? The way you know when your bedtime really is if you are able to go on vacation, or if you have time where you don't have any responsibilities. When would you naturally go to sleep, and when would you naturally wake up? So maybe not specifically holistic or integrative, but those are some of the biggest things that I would encourage. And then a lot of things for women are, are you able to control your stress? Are you taking enough time for yourself? So I'm a big advocate for the last hour of the day is yours. And what does that mean? Well, can you park a car if you're going 70 miles an hour, right? And sometimes my patients come in and they're like, doc, I can't sleep. And I'm like, okay, well, tell me about your day. And it's like their day is jam packed, minute after minute, activity after activity. And then nighttime, they're putting their head at the pillow, 9:30, 10 o'clock. And they're like, wait, I just can't fall asleep because my mind is racing. And it's like, well, have you given it the opportunity to slow down? And then they're like, well, what does that even mean? I'm like, that's a good question. And then I go like, well, what do you like to do? What brings you joy? What brings you peace? Do you like reading? Do you like listening to music? Do you like dancing? Some of my favorite things to recommend that don't cost a lot, it's just getting a piece of paper and jotting down your thoughts. I typically recommend that to do that earlier in the day, not too close to bedtime. Set aside a worry time, because when the thoughts come up at night, then you can tell your brain, well, tomorrow I have that time to deal with it. It doesn't have to bother me now. And then also I'm really big in mind body medicine. So breathing, another free practice where research shows if you can slow down your respiratory rate to 6 breaths per minute or less, that stimulates the parasympathetic response, right? So going back to some neuroscience, the autonomic nervous system's made up the sympathetic drive and then the parasympathetic drive. We very well know about the sympathetic drive, that fight, flight, or freeze, right? And sometimes that's just on a little bit too much. And that's a big reason why we have a hard time winding down at night. But can you strengthen that parasympathetic response? The quickest way to do so, right, if for all the parents out here, is I'm sure you've had kids maybe in their younger age where they've had tantrums and they're screaming and they're hyperventilating, right? So can you get them to slow down their breathing? Can you get them to count to 10? And so doing so, right, they'll be able to calm themselves down because you're switching from stress response to relaxation response. So come up with ways to really improve your relaxation response. One of my favorite exercise to encourage patients who have a hard time relaxing, if they don't like to count, sometimes they're like, sometimes it's almost like overemphasize, right? Just breathe, right? Just breathe, just do yoga and that'll improve your sleep. And yeah, definitely yoga improves your sleep. But I think if you hear it too much, it's almost like commonplace where people don't really find it useful. One of my favorite exercises to teach patients is the 5 senses exercise. And so what do I mean by that? You actually go through your 5 senses. And I do it a little bit differently where, you can do it when you're just lying in bed thinking about your 5 senses. What are 5 things that I can see? 4 things that I can feel? 3 things that I can hear? 2 things that I can taste? 2 things that I can smell, 1 thing that I can taste. But I sort of bring it to the next level. Remember a time where you had just amazing sleep. Maybe you were on a vacation, or maybe you were back in your childhood home and you had really nothing to worry about. And so I grew up sort of in the country of Northern California and farmland. It was really quiet. And sometimes if my busy mind is going, I imagine myself back in my childhood bedroom where I can hear the crickets at night. I can hear the bullfrogs, and there's not a lot of light pollution. There's not a lot of light there. So it's pretty pitch black dark. I'm like, what am I feeling? I'm feeling the comforter. Maybe it's like a really cold winter. I can feel a warm comforter. Maybe I'm feeling my flannel pajamas because I used to wear a lot of flannel pajamas back then. And really bring in your senses. And sometimes it's just giving that person, that patient, that time and space to be still and be quiet. And that's where the healing is. And it's really amazing to witness and bear witness to that.
Yeah, that is fascinating. I think that's one thing I'm going to have to try because it truly does get your mind to quiet down.
Mm-hmm.
It takes away all of the outside chatter, as I call it.
Yes,
So
definitely.
thank you for that. I know I will be
Yes.
trying that tonight. One common myth that we hear consistently is that one, women need less sleep than
I
men. Is
know.
that true? What are your thoughts on that?
I need to figure out who started that lie. I just gave a talk this weekend and somebody asked me that. And you know what? I think it's one of those. Oops, sorry. Did my mic go out or can you hear
You're
me
good.
okay? Okay. Sorry about that. Yeah. So do women need less sleep than men? And I'm biased. I'm a woman. I feel like a man probably came up with that because women just do so much. And it's just like an excuse for, women to stay up late to do our chores and all that. But no, adults need 7 to 9 hours of sleep. And I think probably women get less sleep because we're primary caregivers, certainly. If you're a mother who's breastfeeding your kids, you're definitely gonna get a lot less sleep.
Yeah.
But yeah, no, we still need the same amount of sleep. And then I think there's also some rhetoric out there saying that as you get older, you need less sleep. And yes, as you get older, you do get less sleep, but it doesn't necessarily mean you need less sleep. As you get older, you have more muscle aches and joint pains, which can wake you up. You're on medications that can disrupt your sleep. But yeah, adults need 7 to 9 hours of sleep, and find out your sweet spot and try to get that. Make that really your priority.
Yeah, and gender differences do not matter in there.
Yeah.
What are the most common or top sleep myths that you hear patients bring to you or that you even read about?
Snoring. Snoring is normal. Everybody snores. I don't think snoring is a problem.
Wait, that's not
And
true?
I mean, it's so common. And yeah, it's just, I think it almost boggles my mind, right? Because we probably see so much of it in our clinical practice. I'd say 8 to 9, 10 out of patients, come for, treatment for or diagnosis and workup of sleep apnea. But yeah, even some of the research shows in kids and in adults, snoring is associated with potentially even high blood pressure, changes in your metabolism, issues with blood sugars, right? Some people snore and wake up, and that can disrupt the quality of sleep that they have, even aside from having sleep apnea, right? So snoring is partial collapse of the airway, sort of like whistling, where you don't necessarily have lower levels of oxygen, but it can be disruptive to your body. So yeah, definitely snoring is not normal. I'd say another big myth that I hear a lot is that I need to take something to sleep to be able to sleep, meaning I need a sleeping pill, I need a supplement, I have to take melatonin. Why won't you let me take something? Everyone else is taking something. What's wrong with me? And it's like sleep is natural. It's almost like, drinking water, exercising, moving your body, getting sunshine. It's like maybe you've lost your way. And I think the commercialization of our culture here has sort of promulgated the fact that you need something to feel better. But when you think about what's going on in your brains, sleep happens when your brain waves slow down. I mean, there's other factors like your homeostatic sleep pattern, circadian rhythm, but you can train your brain to slow down without relying on a substance, and probably better for you because as we get older, some of these substances aren't good for our health, meaning associated with dementia, associated with increased risk for falls, and even the ones that are over the counter. Melatonin, just as an aside, is really adulterated, meaning in the US, it's not regulated by the FDA. So there's a lot of contaminants potentially in that. Even the ones for kids, the gummies, there was a recent report in JAMA in 2023, I think it was April, where they put CBD in it. And it's like, what are you doing? So yeah, supplements, I do recommend supplements for a select group of folks who have a hard time, maybe they're going through a big breakup or a health scare. And certainly I think of supplements or, sleeping pills, just like think of pain medications. They can help soothe some of the symptoms, but they don't treat the underlying cause. So my favorite thing to say is you fall and break your arm and your bone is sticking out. Yeah, we're going to give you some morphine to help, help you feel better. But that morphine isn't going to make your bones straight again, right? You're going to have surgery. And so it's really taking a look inside, right? Taking a look inside of your brain and your body. Okay, well, what's really disrupting your sleep? And honestly, for a lot of people, it's obstructive sleep apnea and snoring. And so there's no pill that we have, at least to date, that can improve that. So
I love that your consistent theme is yes, there may be something wrong, but the best place to start is check in with yourself before you start to rely on other things. Love it. As we start to wrap up, and at the very end, I do want to share your website and your social media handles so people can know where to find you and follow you. But what are your top 3 tips for our listeners, for your patients, that you recommend towards them getting towards better sleep?
Yeah. So I sort of talked about this a little earlier, but prioritize your sleep. I think there's still a lot of talk around there that, I'll sleep when I'm dead, I'll sleep when I'm retired, or I'll make up for sleep on the weekends. Figure out how much sleep you need to feel good. How much, your battery needs to be full. How much, if you think of sleep as fuel, it's like, what are you going to do the next day? And, I'm not militaristic. If it's a weekend and there's a show I want to watch, okay, yes, I am a human being. I will stay up a little bit later and watch that show. But also, I don't have a full panel of patients the next day. And if it's just going to be an errand day, okay, it'll be okay for me to stay up a little late. I think another top tip is there's so much information out there in terms of what you should be doing, what you shouldn't be doing, what you should be taking, sunlight, avoid your screens, yada, yada, yada. And one of my biggest beefs with that is to really define, are you a healthy adult who's worried or has a little bit of anxiety versus are you someone in my population who has an underlying medical sleep condition that needs to be addressed? Because the same recommendations for someone who has underlying anxiety, depression, PTSD that's causing their insomnia isn't the same as, maybe a mom who's taking care of her elderly parents and, 4 kids in high school. Potentially, if it's obstructive sleep apnea, but I would say, again, I think doing the whole check-in, seeing who you are, find a healthcare professional. Another thing too is I think there's a lot of shame too. Hopefully I'm encouraging folks that, if you're not getting at least 7 hours, to take a look at why that is. And then if you are still having a hard time, find a healthcare professional. Because one of the things I want to leave you with is that you're not broken. You're not doing anything wrong. Sometimes we just lose our way. We're human beings. And it's very common to have a hard time with your sleep, I'm sure, right? 30% of adults can have difficulty with their sleep at any given moment. A third of us aren't getting enough sleep. And there's multiple reasons for that. And don't let social media or anyone online shame you. We're all on different journeys, but there's hope, there's help, and there's a community to support you so you don't have to feel alone.
That is some solid advice. Where can our listeners find you? What is the best place for them to follow you and learn from you?
Yeah, so if you're a woman in midlife, my best resource is Sleephoria, which is my online educational community brand. And the real premise of Sleephoria is a well-rested woman has the energy, clarity, and drive to change the world. And so you can find me on my website, sleephoria.com. I do mini webinars twice a month on YouTube, and everything is for free. I'm going to put out more information about actually sleep medicine topics. I have a video about alternative therapies to CPAP that people really like, and also restless leg syndrome. And it seems like people really like the medical sleep topics. And I was thinking they like more of the integrative topics where we talk about breathing. I think there's enough of that probably. But yeah, I think just talking about women's sleep in terms of a medical perspective. So yeah, you can find me on YouTube.
That's amazing. And she has some great stuff on Instagram as well for those that are listening in. We will have Dr. Val's websites, ways to contact her, social media handles, everything in the show notes. As always, if you are listening, you probably know somebody that could benefit from the amazing information she has dropped on our show today. So don't forget to invite a friend, share this episode, go follow her, tell your friends to follow her. So much to learn. I want to say thank you for taking time today to come and talk to us. And like I said, I know I'm going to put some of these practices into play starting tonight. And it was a pleasure.
Oh, my pleasure. Happy to be here, Dr. Meghna. Thank you so much for your time.
Thank
and
you.
Sleep well, everybody. Bye-bye.
Yes, sleep well. I will see everybody next time. As I said, share her information, go follow her, share this episode, and I will see you next time.